Hi, Dr. Anjana Bada here, coming to you from our practice kitchen. Thank you for joining me again today, and we're going to carry on our talk about filler and what kind of filler might be the best kind of filler for you. How much filler do you need? So we get a lot of these questions in-house. What kind of filler are you using? How much filler am I going to need? And of course it's patient dependent. Like everything in life, it depends. So I'm just gonna go through a couple of the fillers that we have for you. So this was from the last video we did with fillers. So you can see this filler is just, it's stuck on. It's cohesive, it's not going anywhere, and that's what you want. You don't want the filler to move around, but fillers do, like we know, migrate. So there's a soft filler that we injected that's kind of flowing, and then there's this like gloomy, very mountainous, like robust filler that doesn't seem to be moving very much. So that type of filler is great for chins, for cheeks, because it needs to go under strong muscles, it needs to go on bone and almost replace the lost bone. But the light filler, this one here, that's kind of like it's super light, it's almost like syrup. That is a skin booster. That is injectable moisturizer that goes just under your skin, absorbs 1,000 times its own weight in water, and is incredibly hydrating, and that is actually meant to spread and move around, whilst this one is meant to not integrate and stay where you've placed it. Just to show you, so a filler generally comes like this in a 1 ml syringe. This 1 ml syringe, what can this do? So 1 ml can generally do the lip area, and sometimes 1 ml is a bit too much for lips, but we must remember that our face is like a holistic entity, so we can't just look at nose, lips, cheeks. You have to think about the lips as the lip as part of a bigger unit. So when I do the lip, I often do the lip as well as the area around the lip. So this could do the lip, the corners of the mouth, maybe a little bit of the area underneath the lip, this little crease here, just so the lip is better supported. This could also do a cheek, depending on the type of filler. If it's a really robust filler, you could use one of these to get a subtle cheek lift. If you want something more dramatic in the cheek, then 2 syringes is the way to go. On the chin, one of these, one whole one of these would go on the chin. And then a lot of people ask me, we like doing jaw lines. I think last year there was a trend in terms of sculpting the jaw, and we shouldn't follow trends. You should follow what's right for your face. But just to give people an idea, you'd need 4 of these to get a naturally sculpted chin, so and jawline. So 1 for the chin, 2 for either side, and maybe splitting 1 to inject just in front of the ear to create like an uplifted look. So that's quite a, that's quite a bit of filler, but on average that's what a person would do in 1 sitting, which is relatively safe. And then just to show you what a skin booster looks like, so that gloopy filler, so that's what it looks like. It's very liquidy, and it's like water. It's like water under your skin. So small particles and absorbs a whole lot of water, and very, very hydrating. Let's see if we can get something a bit more robust. So this is a bit of a more robust filler. Something like this would actually go. Some of the skin booster is still left, but if you can see the difference, it's like creating like a little globule there. So something like this would actually be injected onto your chin and stay there. It won't drop off like that. So there's so much to know about fillers. I would recommend that you have a proper and full and comprehensive consultation with your aesthetic practitioner before deciding what to do, and have a plan. So you must have a face plan, have a holistic face plan that might span a few months. Don't just concentrate on one unit of your face. And remember, fillers are medical devices, so before any of these procedures are done, an informed consent process must be gone through. So if you have any questions about fillers or any aesthetic procedure, I love answering questions. Please drop a question in the comment section, like and share and subscribe. Thanks guys for joining me today. Bye.